Okay, so we've just got a couple last things to finish up here when thinking about these different populations that you might be working with as a clinical exercise physiologist. And one of those populations would be type 2 diabetics. And again, when we think about who this person might work with when they're diagnosed with type 2 diabetes, they would certainly be working with a dietitian who is going to help them to understand the idea of glucose kinetics and how we might be able to modify their diets in order to kind of combat this disease. And then also with a clinical exercise physiologist, where we're able to incorporate both strength training, which is going to enhance our insulin sensitivity or our glucose uptake. And strength training can actually have its effects last up to 72 hours for these particular people. So essentially, if we could have these people come every third day, we could really enhance their glucose metabolism and help them combat this disease. Now, certainly we also want to include aerobic training into their program as well, because weight loss will enhance their ability to combat this disease as well. And our research actually shows that this disease can be completely eliminated with changes to their diet and their exercise or physical activity routine. So a lot of positive outcomes from working with a clinical exercise physiologist in this regard, and we can take care of this with just behavior modifications, including, like I said, nutritional changes, as well as adding strength training and some aerobic exercise into their lives. So when we think about orthopedic conditions, certainly, arthritis and osteoporosis are both common issues that are experienced in our older population. Arthritis, again, is going to result in some pain in the joints. And a lot of people think like, oh, if I have arthritis and my joints hurt, then I should do less so that they don't hurt. In reality, it's actually the opposite of that. So by doing exercise or by getting active, we're going to increase blood flow to those particular areas, and that can actually eliminate or reduce some of the pain in the joints experienced with people that have arthritis. Now, certainly there are types of exercise that we would want to stay away from. We might want to do some light some light intensity resistance training, some isometric types of exercise, so we're not having a huge range of motion change in these particular joints. So again, those might all be components of the exercise prescription for that population. When we think about osteoporosis, again, this is a decrease in bone mineral density, and so for this population, by contracting the muscles, whether that be weight-bearing exercise or strength training, we can see the bones are there's stress placed on the bones when the muscles contract, and so as a result of that stress placed on the bones, we see an increase in bone activity, and that can result in an improvement in the bone mineral density. Again, as we mentioned, cardiovascular disease is really our bread and butter in this field in terms of the types of people that we're going to work with. So before initiation of an exercise intervention, healthcare professionals must complete a complete health screening, and stress testing, as we mentioned, would be part of this evaluation so that we can kind of understand the risk associated with each exercise session that the person might be going through. Again, this is a very, very common condition, the prevalence in like the 80 millions for total cardiovascular disease cases. So again, this is going to be certainly the bread and butter of who we are working with in the clinical field. So when we think about the functions of these stress tests, like what are we trying to achieve here? 6 different factors that we want to consider, or 6 different factors that we need to consider when doing these tests. So number 1, diagnosing heart disease and screening for silent coronary disease in seemingly healthy adults. So again, we can look at those EKGs, we can look at the blood pressure response to exercise and be able to diagnose particular conditions based on those results. Number 2, assess exercise-related chest symptoms. So again, we want to see when that person starts to experience chest-related symptoms, at what intensity, and so therefore we will know in the future to not go to that intensity if that's going to induce some cardiac issues. Number 3, we want to screen candidates for entry into preventative and cardiac rehab exercise programs. So again, complete a screening so that we can understand whether or not these people would be appropriate to complete the exercise program. Number 4, uncover abnormal blood pressure responses. So again, we're going to measure or monitor blood pressure every 1 to 3 minutes during these exercise graded tests and look to see what their blood pressure response is and make sure that that's normal. Number 5, we want to monitor effectiveness of therapeutic interventions such as drugs, surgery, dietary modifications in order to improve cardiovascular disease and cardiovascular function. So again, we can use these tests as kind of a marker of improvement, based on these various interventions we might use. And then number 6, quantify aerobic capacity to allow us to see where this person fits in and what we need to do to get them back to normal or to normal in the first place. And, like we said, we could use this to kind of see progress through a program as well. We mentioned that it was the late 1950s when we kind of got started with pulmonary rehab. Again, when working with pulmonary patients, we're working primarily with COPD, could be emphysema patients, could be cystic fibrosis. Those are some examples of the diseases that we might work with. What are our goals in the pulmonary rehab realm? We want to certainly improve their health status, improve respiratory symptoms, so again, shortness of breath and cough, decrease frequency and severity of respiratory problems, enhance oxygen saturation, and enhance daily functional capacity. So again, we can use aerobic exercise at a light intensity to kind of improve our fitness in that regard and help with some of these potential issues that we experience with pulmonary disease.